Welcome to you both.
Thank you for having us.
And Robert, we're going to get to your story in just a moment because I know you spent decades in pain. But first of all, let's talk about this issue that so many people are facing, neck pain, back pain. And for a lot of people, they just assume that they either have to live with it or go through some sort of radical treatment.
Well, pain can be very debilitating, and it can really affect your quality of life. It can affect your ability to function with your kids, go to work, and have a productive lifestyle. And so a lot of patients, as you know, you probably have had back pain yourselves. Everyone will have some degree of back pain in their lifetime, but usually it's very self-limiting. But there are certain situations where that pain will continue, and it'll be very persistent, and it'll just bring you down. And so at the Houston Veterans Hospital, we have a center there called the Spine Solution Center, which is dedicated solely to neck and back care. Although we're located in the Webster area, we have 15 different physical therapy locations throughout the city. We have a dedicated patient navigator. If you call without any referral, we can get you into a medical professional within 48 hours. Most people, when they come in their office, don't want any surgery. I get it. I don't want surgery.
Yeah.
And so that's why we work with a team of specialists, including pain management doctors, physical therapists, and we're really able to guide the patient to the right and most appropriate step. And so in all circumstances, we always attempt to use conservative care first. And so that's usually some form of physical therapy, medication, or injection. And usually if those things don't get a patient right, then it'll keep on going up the ladder, and then that's where you'll find someone like myself.
There you go. And I think what's really important here is you said it in the beginning, no referral needed, which is really, and I think that's part of the process. Sometimes people think it's going to take too long to try and get all these questions answered. And Robert, that's where you come in, because literally you were living with pain for about 20 years. I mean, what were your symptoms?
Just a constant pain and stiffness in my shoulder and my neck. I just couldn't get long-term relief. And in the last couple of years, it got so severe I couldn't sleep. My hand was going totally numb, and I had pain radiating down my arm, and I knew, and I couldn't turn my head very past this point. But now I have full range of motion and no pain and no stiffness, so I'm so glad that I was told about Dr. Jones.
And here are some before and after photos that are up on the screen. Maybe, Dr. Jones, could you just walk us through what we're seeing here?
Sure. So on the left side, you're seeing a picture from the side of Robert's neck. And if you look down there, you'll see some bones that look like they're kind of together, where something's pointing out the front side right through there. And so that's it between the 5th and 6th cervical bone. And so what we did, he had a nerve that was being pinched there, and his disc was completely worn out, so his bones are just rubbing on each other.
So bone on bone.
Bone on bone.
I could even, it was painful.
Yes. I could even hear it.
Bone on bone.
Oh my gosh.
And so what we did is on the right-hand side, you'll see an x-ray of him, where we're looking at his neck from the side, and we did a disc replacement. And so what we did, and you'll see with the next two pictures, how that disc is really nice, and it's an alternative to fusion. And so traditionally, the only thing that we can do for patients who had pinched nerves and bone-on-bone disease would be to actually take out the disc and then fuse the bones together. But that can lead to other consequences down the road. And so if you look at this picture right here, you'll see the black space in between the metal implants right there. And you can see how that black space will change depending upon his direction. And it's great because people can still maintain a really active lifestyle. There's not much recovery needed. It's outpatient. This takes maybe about an hour to an hour and a half to do.
This is an outpatient procedure?
He went home the same day.
Yes.
That is incredible.
And how soon did you notice a difference, Robert?
Right after surgery. I still had some pain from the surgery, but as far as the severe pain in my neck and shoulders and the stiffness, it was gone.
Oh my gosh.
Unbelievable. And you had surgery in September, is that right?
Of last year.
Last year, yeah.
Yes.
So coming up on a year, and quality of life is completely different for you now.
Oh, absolutely. I feel like I went back in time 20 years as far as the way I feel.
That is so awesome. And Dr. Toot, what's great is that, you know, the aftercare, I think, is really important to make sure that, you know, of course, before when you come in, you walk through and see what kind of treatment, but the aftercare is just as important to make sure that people get their physical therapy, and you make that very easy for your patients.
Sure, we do. You know, the whole experience of having surgery is just really just nerve-wracking. It's frightening, and, you know, people are really anxious about it. And so from the very moment we decide that you are a candidate for surgery to the very end of your experience, we try to walk you you through that step the entire way. And so there are people who are going to call you ahead of time to make sure that we've checked upon your medical problems, to make certain that there's nothing that we're going to be missing at all. We have dedicated nurses, and a lot of the staff there has been there for years. I've been working there for several years, and I see the same faces when I walk in. And so one of the things that's really great about that hospital is that we can have the same outcomes day in, day out, because we have the same staff, so it's very reproducible. And so when patients come in there, they're going to see the same, when I come in there, I'm going to see the same face, and I know that every single time that I come in there, it's going to be done the right way.
All right, well, folks, thanks so much, Dr. Jones. Robert, glad to see you doing well today.
Thank you.
Sorry we are tight on time. You guys have won such an incredible list of awards, by the way, and the highest ratings in the state of Texas for Medicare.
People like coming.
Incredible. All right, well, to learn more about the organization, HoustonPhysiciansHospital.com. There's the website on your screen. You can visit them online, or you can call 281-645-5611. Thanks, guys.
Thank you.
We'll be right back.